Hi, good day. This is our group presentation on the case scenario, diabetic ketoacidosis. Our group members are Mona Lisa McLeod, Katura Francois, Melissa Isaac, Crystal Calise, Isaiah Scipio, Marissa Martin Sales, and myself, Katisha Thompson. Our objectives are focused on being aware of who Dorothea Elizabeth Orem is, to understand how to apply her theory, to know and how to treat diabetic ketoacidosis, and to know the pathobiology of diabetic ketoacidosis. Our scripture reading today is, "Fear not, for I am with you. Be not dismayed, for I am your God. I will strengthen you. I will help you. I will uphold you with my righteous right hand." Isaiah 41:10. We will start with an overview of Dorothea Elizabeth Orem, a nursing theorist who lived from July 15, 1914 to June 22, 2007 in Baltimore, Maryland. After high school in 1931, she enrolled in Providence Hospital of Nursing in Washington, D.C., where she was awarded many honors. After college, Dorothea developed the Orem model, which is acting for and doing so for patients, mentoring patients, encouraging patients, establishing an atmosphere that nurtures self-improvement in connection to expected outcomes, and educating patients are the 5 techniques of self-care identified by her theory. The nursing paradigm is aligned with the targets of health promotion and sickness prevention, and it considers humans as a summative entity that has got to adapt to their environment so as to realize their goals. Relevance or application of the theory in our case scenario. Dorothea Orem's theory speaks candidly about patients caring for themselves to maintain and sustain health and well-being. In this case scenario, the patient refused the help of medical professionals to proceed with her husband's herbal remedies to treat her diagnosis of type 2 diabetes. Since the herbal remedies did not promote health and concluded with Mrs. Williams feeling worse and was admitted to the hospital, it cannot be considered as self-care. However, as a nurse, we can use Dorothea's theory to educate and provide holistic care for Mrs. Williams whilst taking into account her current abilities. The pathobiology and the diabetic ketoacidosis. Hyperglycemia, hyperketonemia, and metabolic acidosis are symptoms of diabetic ketoacidosis, which is an acute metabolic consequence of diabetes. Osmotic diuresis as a result of hyperglycemia, resulting in substantial fluid and electrolyte depletion. Diabetic ketoacidosis is more common in people with type 1 diabetes. This then manifests as nausea, vomiting, stomach discomfort, and it can lead to cerebral edema, coma, and even death if left untreated. Hyperketonemia and anion gap metabolic acidosis in the midst of hyperglycemia are used to establish diabetic ketoacidosis. Volume expansion, insulin supplementation, and hypokalemia prophylaxis are parts of the treatment. A plan of care for the patient. The objective data: type 2 diabetes, nil orally, vomiting, fruity scent on breath, temperature of 37.1, pulse of 88, respiration of 32, SpO2 of 98%, glucose level of 454 milligrams per deciliter, elevated urine ketone levels. Our subjective data is confused and complaints of thirst. The aims or objective of the nursing care plan is to decrease temperature, reduce and monitor glucose levels, administer insulin appropriately to prevent ketone production. Continuation with the plan of care for patients. Our short-term goals is to decrease patient temperature to 36 degrees within the first 24 hours, to bring glucose level to within the regulated normal range within 24 hours, and to hydrate to normal level of electrolyte levels. Our long-term goals is patient glucose level is maintained, patient is hydrated, patient's ketone levels is within the normal range, patient can care for themselves and be fully oriented to place, time, and person. Nursing interventions. We first will monitor glucose levels over 454 milligrams per deciliter. Patient is to receive fluid and electrolytes through IV to prevent dehydration. Patients are to be monitored for signs and symptoms of infection. Medication must be administered accurately on time as prescribed by doctor. Patients are to be thoroughly educated on health, nutrition, and lifestyle they must live by in the future. Teach patients signs and symptoms of diabetic ketoacidosis. Educate patients when to exercise, and to educate the importance of taking medication and following medicine instructions. That brings us to the conclusion. And to summarize, diabetic ketoacidosis is a life-threatening condition, and people with the condition should indeed learn to manage it in order to lower diabetic ketoacidosis-related incidence and mortality. The theorist that was employed was Dorothea Elizabeth Orem, who devised the Orem's model of framework, which is associated with self-care deficit nursing theory and aims to provide patients with a holistic therapy that helps them become more self-sufficient and better than when they first arrived to the hospital. Thank you kindly for your patience and your time. Hope you enjoyed our presentation.